Hello guys, welcome to SKK classes NZ again. So today our topic of discussion is intravenous fluid, especially the NS, that is normal saline. So today in this video we will discuss about normal saline, that what are the main indications, what are the main ingredients of normal saline, and in which conditions the normal saline can be used. So let's discuss about normal saline. So normal saline, which is commonly known as NS, that is a mixture of sodium chloride plus water. Okay, that it contains sodium chloride as well as water. And how much the quantity is there? That normal saline will contain 9 gram of salt. Okay, 9 gram of salt per liter. That is 0.9% of solution. And the normal pH of the normal saline is 5.5. Okay, but our pH of blood that lies between 7.35 to 7.45. So the pH of normal saline is acidic and it is 5.5. So these are the main ingredients. Means per liter of solution that contain normal saline, that is 9 grams. So this was the you can say the ingredients that normal saline that will contain sodium chloride as well as water. Let's discuss the indications. Okay, so in which condition we can provide or we can start the intravenous therapy of normal saline to the patients. Suppose if the patient is like in the hospital and he or she's having a dehydration. Okay, so in that situation what you have to do, you have to start the normal saline, you have to start the intravenous therapy with normal saline. Okay, or if the patient is in shock, okay, and if the patient is having a hypovolemia, okay, and all of you know that if the patient is in shock, it normally you can understand that patient the blood volume, or you can say the fluid volume is decreased. Okay, so if the fluid volume is decreased, we have to immediately start the intravenous therapy with normal saline. Or if the patient is in sepsis, in that situation we have to start the normal intravenous therapy with normal saline. Okay, and apart from this, if the mild sodium depletion is there, in that situation we also have to start the you can say intravenous therapy with normal saline. So these are the main indications in which we can start the intravenous therapy with normal saline. And another point is there, if the patient is having a you can say metabolic alkalosis, sorry, in metabolic alkalosis in the presence of fluid loss, then in that situation we have to must start the intravenous therapy of the normal saline, just to restore the fluid volume of the patient. So these are the main indications that in which we can start the you can say the intravenous therapy with normal saline. And here I would like to clear that if the patient is having a high blood pressure, okay, so in that situation doctors always you can say concern about this thing. So we have to go according to their prescription, but the main indications are these. So now see in this picture, here all the indications are given. First one is here to treat low extracellular fluid, as in the fluid volume deficit from. Okay, suppose if the patient is having a fluid loss due to any reason, it may be the hemorrhage, okay, severe vomiting, diarrhea, or heavy drainage from gastrointestinal suction or fistula or wound. From in that situation what happen, the patient fluid get lost. Okay, and just to restore the fluid volume of the patient we have to provide the intravenous therapy with normal saline. Next one is your shock. Okay, means we have to start the intravenous therapy immediately in the condition of shock. So because if the patient is in shock, so why he or she is in the shock? Because his or her fluid volume get lost. Okay, so in that situation we have to start the intravenous therapy with sodium chloride. Then comes your mild hyponatremia. Hypo refers to decreased, and natremia that refers to low sodium level in your body. So in that situation what you have to do, if the patient is coming in your hospital, in that situation you have to immediately start the intravenous therapy with normal solution. normal saline. Then comes your metabolic acidosis. Metabolic acidosis, if it's there, especially in case of diabetic ketoacidosis, in that situation you have to start the intravenous therapy with normal saline, because in my previous video I have already cleared about the diabetes mellitus. Okay, and diabetes ketoacidosis, that is the main complication which can occur with the patient who is having a diabetes mellitus. And what happen in the diabetic ketoacidosis, that lot of ketone bodies that get formed. Okay, and how? Because in diabetes mellitus, all of you know that we need glucose to get energy from it. But what happened in the diabetes mellitus? If the sufficient amount of insulin is not there, then the metabolism of glucose become difficult. So, and what if the in diabetic acidosis, what happened? The body started taking or forming the glucose from the fat which is stored in your body. Okay, and all of you know that if the metabolism of glucose is there, then it will the waste product of after metabolism of glucose is you can say energy plus carbon dioxide plus water. Okay, plus oxygen. And if the metabolism of fat take place in your body, it will form ketone bodies. So that is the main reason that sometimes if the patient is in the hospital, doctor always gives you the order to send the patient urine for ketones. Why doctors order to send the urine for ketones? Because they want to know if the patient is having diabetic ketoacidosis or not. And it depends upon the report of the that sample, that is it positive or negative. If the urine for ketones for is positive, so doctor will start the treatment according to that. So these are the main indications. And if the it is normal saline is also the fluid of choice for resuscitation efforts. Okay, means if the patient is in cardiac arrest, so in that situation what you have to do, you have to do the CPR, you have to you can rush the fluid normal saline specially, just to restore the blood fluid volume of the patient. And it is the only fluid used with the administration of blood products. Means if you are giving blood to the patient, I mean to say, if you have already started the blood transfusion, okay, so side by side you can also provide this normal saline intravenous therapy to the patient, and it's having no side effect in that situation. So this is all about the indications of normal saline intravenous therapy. So this is all about the normal saline ingredients as well as indications. I think now it's very much clear to all of you that what are the main indications and in which conditions we can use the normal saline intravenous therapy to the patients. Thank you for watching SKK Classes NZ.